Okay. Um, so I'm just going to do a brief review of of when Jefferson implemented a blood transfusion reduction protocol in the hospital, and specifically within the realm of spine surgery. Um, next here. So just a brief overview of the background on why this is important to look at is that blood transfusion is actually one of the most overutilized procedure currently in U.S. hospitals. Most of these transfusions are actually qualified as unnecessary. Within the group of people that frequently do blood transfusions, the spine surgeons and the spine surgery group is actually being one of the top users of blood transfusions in the hospital. There's actually extensive literature out there that indicate that there are significant unfavorable outcomes associated to blood transfusion. So we sort of have to know that a blood transfusion is not a completely benign thing that we do, and we actually do it pretty often. Um, so there's some in vivo studies that have demonstrated a significant increase in blood potassium and lactate concentration after a transfusion of a single unit of blood. There's also issues with storage of blood products. When blood is stored for some period of time, it can even act as a nitric oxide scavenger, which ultimately leads to endothelial dysfunction, and this can down the line precipitate a vasoactive events such as DVTs and PEs. Also, the use of stored blood products has also been demonstrated to not increase the blood oxygen carrying capacity. So it doesn't really have the desired effect that we think it has when we do it for our patients. So the theory is that improved blood transfusion practices may help improve hospital quality indicators. Before the blood transfusion protocol was implemented at Jefferson, the patients were regularly being transfused for hemoglobin of greater than 8 or less than 8, rather. People were being transfused for a decrease in oxygen saturation, fatigue after a long spine case, and a bunch of other reasons. And there was basically no consensus and no guide to help figure out which of these transfusions were indicated. And so part of a patient blood management system was created, which encompasses a bunch of things. And one of them is the reduction of blood transfusions in the hospital. Some of the other things that it encompasses is actually, it looks at trying to reduce blood loss during surgery. This is why we have protocols in place in the OR, such as sometimes we give patients TXA, and we use cell savers just to try to minimize the overall blood loss during the procedure, and therefore, again, try to reduce the amount of blood transfusions that we do. Some of you guys might be familiar with this window on Epic, which is also part of the patient blood management strategies at Jefferson. So whenever you try to order a unit of blood, this little window will pop up, and as you can see, there's a section that says indications. And we'll highlight the one that says acute bleed greater than 1 liter, and also chronic anemia for less than 7 grams per deciliter of hemoglobin. One of the things that we have to know is that it is important to, during your preparation for surgery, to know whether you're expecting a high blood loss during a procedure, because it's actually better to pre-transfuse than transfuse after the blood loss has happened. And the thought is that um, you partially use some of the red blood cells that have been transfused and your own, rather than just using your own and being transfused with a bunch of new red blood cells and all of the adverse effects that come with them. So basically, our project, we did a retrospective review of quality measurements in spinal surgery cases since the implementation of the protocol for years 2017, 2018, and 2019. As you guys may know, we have a pretty busy spine surgery practice, and it certainly encompasses a pretty heterogeneous group of procedures. Some of them are very long and very morbid with expected large blood loss expectations, and other ones are not as much. For the purposes of this presentation, I'm going to concentrate in a combined anterior and posterior spinal fusion procedure, which, as you guys may know, is one of the bigger procedures that we do, which you know would expect more blood loss than the others. We looked at comparison of length of stay, complication rates, readmission rates, 30-day readmission rates, and for some of the most common spinal procedures. And we looked at what happened with the patients that received blood transfusions and with the patients that did not. So for the year 2017, the mean length of stay of patients with that received a blood transfusion after a AP lumbar case was about 7.5 days versus without blood transfusion 4 days. And within a 95% confidence intervals, this was a statistically significant difference. Basically, the patients that did not receive a blood transfusion seem to have had a hospitalization course cut in half, basically. And so this is, a graphic that demonstrates how much of an impact it has in lengths of stay. Other things that, we looked at was a complication rate, and these were defined as any unexpected event during the hospitalization, may be a DVT, PE, DIC, infections, sepsis, pneumonia, and others. So again, it's a similar story for these 3 years. So patients that receive blood transfusions had a complication rate of about 10 to 15%, versus patients that did not require a blood transfusion had a complication rate of single digits, less than 5%. And also, days spent in the ICU was also less, although not significantly, not statistically significant. And then lastly, looking at 30-day readmission rates, patients that were involved receiving blood transfusion had significantly higher rate of readmission at about 10 to 15% versus 3 to 5% for patients that did not receive blood transfusion. It's important to know that these parameters that we looked at are complex and obviously have multiple contributing factors. It's not only the fact that the patients receive blood transfusions. There's many other things that come into play, but certainly after reviewing the data for more than 900 cases, the data certainly supports that there is improvement with the creation of the patient blood management program. So there is a clear benefit on the conscientious use of blood products in the spine population, and this has been associated with better outcomes, decreased length of stay, and decreased readmission rates. So obviously this project is still very young, and moving forward, we'd like to see if we can formalize a clinician education program to further inform the staff about good blood transfusion practices and to be distributed amongst the house staff, given that not every clinician knows what the adverse effect of blood transfusion may be, and information may serve the purpose of limiting unnecessary blood transfusion to a minimum. And then after this is done, we're going to continue to monitor the response to these interventions over the next 1 to 2 years and see if this continues to improve the quality metrics of the spine surgery service in the hospital. And that would be, sorry, those are my references. And